Hello, I'm Kerry Angard, MS International Federation's Director of Programmes, and I'm pleased to welcome you, wherever you are in the world, to our live webinar on Progressive MS. Happy Thanksgiving to those of you celebrating today. This is your chance to ask questions about Progressive MS directly to international experts. We received a lot of questions in advance. Thank you. You can still ask questions by tweeting us using the hashtag MSIF webinar or by emailing support@msif.org. Please let us know which country you're from. If you experience any technical difficulties, don't worry, and you can watch it again at any time. Pierre Barnaker, our Chief Executive, has just arrived back from Russia and has popped in to say hello.
Thank you very much. Thank you all for the many suggestions you've sent us for question to answer. We've had questions about diet, about alternative medicine, about myelin repair and about myelin protection, about exercise and about rehabilitation, about stem cells, of course, and also about the search for a cure. Now, these are too many questions, of course, to tackle in 1 hour, in one webinar. So we'll start off with Progressive MS, because that was the issue where most of you asked questions about.
Thank you, Pierre. Now over to your host for the webinar, Dr. Dia Chandraratna.
Thank you, Kerry. Hi, I'm Dr. Dia Chandraratna, Head of Research at the MS International Federation, and I will be your host today. We are delighted to have with us two world-renowned experts in MS, Professor Alan Thompson and Professor Olga Ciccarelli. Professor Alan Thompson is the Chair of the International Medical and Scientific Board of MSIF and the Dean of the Faculty of Brain Sciences at University College London. Professor Olga Ciccarelli is a Professor of Neurology at University College London and also one of our first ever Dupré Grant recipients. Today, they will be answering your questions on Progressive MS. We have already received many questions from around the world, but please do keep your questions coming in on Twitter at hashtag MSIFwebinar or by emailing us on support@msif.org. So let's get started. Alan, as an introduction to the topic, can you tell us what is Progressive MS?
Yes, certainly. I think I'd begin by saying a few words about multiple sclerosis itself and then moving on to the progressive form. So as many of you will know, MS is a condition which affects the brain. It causes inflammation, damage to the myelin sheath, and damage to the nerve fibers themselves. It often affects young adults, and it usually causes attacks or relapses which come and go over time. But then you can also have the progressive form of MS, and that basically is describing a gradual change over time, a gradual worsening of disability over time. And there are two forms of progressive MS. There's primary progressive, which occurs from the onset. So right from the very beginning, people notice that they have some deterioration, usually in their walking, which gets gradually and sometimes quite subtly worse over time. And then there's secondary progressive MS, which occurs maybe 5, 10, or 15 years after relapsing or remitting MS. And again, you notice this very gradual progression over time. So primary and secondary progressive MS and probably constitute together up to 50 to 60% of the MS population worldwide.
Thank you, Alan, for a very clear introduction. We have some questions coming in now, one from Karen Hemion from Canada and Joanne McKee from the United States. And this is a question to Olga. They want to know, why are there no treatments for progressive MS and what are the challenges in finding treatments for progressive MS?
Yeah, so that's correct. We don't have available treatment for slow down progression in progressive MS. And this is due to the fact that we do not fully understand the mechanisms of progression. So there's been a lot of research and there's been progress on understanding these mechanisms, but until we understand fully why there is a neurodegeneration causing progression, then it's difficult for us to treat it. Also, there is a challenge in identifying outcome measures for clinical trials, in measuring the efficacy of treatments, in performing large clinical trials which with suitable medications. So there are a lot of challenges, but this has been tackled in recent years, and hopefully we'll have some good news soon.
Thank you, Olga. The next question is from Jan Zanting in Netherlands and Linda Doubleday from New Zealand. And they would like to know, this is a question to Alan, why isn't more research being done on progressive MS?
Well, I begin by saying I agree completely with Olga that this is a more complicated form of multiple sclerosis and one which we don't understand as well as the relapsing remitting form. But actually there is quite a lot of research going on in the world, and I think the last estimate when we looked worldwide at all the research that was being supported, it was up to $90 million spent on research into progressive MS. But there are a couple of points to make about this. I think it's not very joined up, so there's research going on in different parts of the world independently. And of course the key thing is that none of this research has got over the bar and has resulted in a treatment. And until we have a treatment, people feel that there's not a lot going on. There is a lot going on, but there is a real potential to bring all this research together, to focus it more, and to be more strategic in how we approach it. And that's really why the Progressive MS Alliance was established.
Thank you. And just following on from that, really, is we have a question from Kevin Kelly in Ireland and Kate Cherry from Australia. And they would like to know, what is the Progressive MS Alliance and what are they trying to achieve?
Well, I've given an introduction to this already. So the whole idea of the Alliance is to bring all the researchers across the world together to try and tackle this very difficult issue. I think if you've got something that's very challenging, you need collaboration to try and understand it and then to treat it. So the Alliance is about bringing together as many people as possible with expertise in the area to tackle the problems or the issues that are blocking or slowing treatment to progressive MS. So Olga mentioned some of those, and they're around having good models of the disease, understanding what's happening within the tissue in people with progressive MS, identifying targets for treatment, having trials, both early trials and then larger, more definitive trials, having outcome measures that we could use in those trials, and then the hugely important area of symptomatic treatment and rehabilitation. So the Alliance is really trying to drive this area forward. It's an alliance of MS societies around the world, brought together by the MS International Federation, and its focus is on treatment for progressive MS.
Thank you. And following on from that question to Olga from Non Smith in South Africa and Sue Morris from the UK. Alan just talked about some of the areas that the Alliance is trying to focus on. But can you tell us what are the most promising areas of research in progressive MS?
Yes, so the most promising, as Alan said, is trying to identify a treatment that slows down progression in MS. And I think this can be done by researching the mechanisms of the disease. This is achievable by studying people with MS, with clinical assessment or repeated imaging assessment, and trying to understand what is contributing to clinical progression. Then important area of research are those that aim at developing outcomes which we can use in clinical trials to identify whether people are having a good response to the treatment, so to understand whether the treatment is effective for MS or not. And then there is important research trying to identify measures for prognosis. So we want to be able to tell a person with MS whether it is likely to progress faster in a shorter period of time or perhaps slower in a longer period of time. So we wanted to give answer to individuals about their futures, about what's going to happen in the following years. So something that also makes a difference for individuals. And then obviously the area of treatment trials, as I said, trying to bring together different centers with different expertise worldwide to perform these very challenging clinical trials to test efficacy of medications.
Thank you, Olga. So we've had some really interesting questions coming in, but don't forget you can still send in more questions on Progressive MS on Twitter at #MSIFwebinar or by email on support@msif.org. Now we know there's also been a lot of interest in other areas of research, and if we can raise the funds, we would love to put on other webinars like this in the future. So if you can make a gift, please use the simple form at the bottom of the page. Let's go back to our questions. The next question is to Alan from Dan Favotto of Australia and Karim Dyer of Canada. And they would like to know what are the best available treatments currently for progressive MS?
Well, I'd make 2 points to begin with. The first is that we don't have a specific treatment for progressive MS, as Olga has mentioned earlier. But the second is that all forms of MS need a very active management plan, and that's the same for relapsing remitting as it is for progressive MS. So health is really important, keeping yourself well is very important, looking after yourself, a good diet, exercise, also very important. In progressive MS, you get a number of symptoms, difficulty with mobility, with bladder, tremor, and all of these need to be treated symptomatically, and that's crucially important. And of course, rehabilitation is also key, which brings together all the symptomatic management, but also improves quality of life for patients with progressive MS. So having progressive MS isn't about not having active management. It's absolutely critical. In fact, arguably, it's more important to be actively managing your condition when you have progressive MS than with relapsing remitting MS.
Okay, thank you. The next question is to Olga, and it's from Bergthora Bergsdottir from Iceland and Gillian Hirsch from Israel. And their question is, are there new treatments on the horizon for progressive MS?
Yes, definitely. There are new treatments. Some of them are undergoing clinical trials, so they are already being tested in phase 2 or phase 3 clinical trials. Others are more experimental, so perhaps further away from clinical trials. And these are treatments that are trying to target neuroprotection, so trying to protect the tissue from further damage. And then you must have heard of treatments that are trying to repair what has been damaged. So I think these are the two mainstream, either protect the central nervous system, the cells from further neurodegeneration, or trying to improve the conductions along the nerves, so trying to restore some of the functions, so repair what has been lost. And there are medications, that completely new medications being discovered, but also some older medication that are now going to be tested in progressive MS to see whether they can have an effect. So I think, as Alan said, there are a lot of going on, and we expect, we hope to have something available in the near future.
Great. And the next question is on stem cells for Alan, and it's from Ladislava Basitkina from Estonia, Christian Olesen from Denmark, and Teresa de Marcos from Spain. And they would all like to know, is there hope for stem cells as a treatment for progressive MS?
So again, I'd begin by saying that stem cells is a topic that has been discussed now over a number of years, and it's one that there's always been great hope for, but it's taking quite a long time to realize that hope. So where are we at the moment? I think we've had a number of small studies looking at different forms of stem cells. There are many different kinds, and insofar as those small studies can be evaluated, they do show some evidence, some encouraging evidence, but none of them are absolutely clear in their outcome. And I think what we need with stem cells is larger trials, or bringing together small trials to get a more definitive answer. So this is perhaps a rather long-winded way of saying that yes, there is potential and there is hope. Stem cells suppress inflammation, but they also encourage repair or remyelination. So we've got two actions which would be very useful in multiple sclerosis. There is hope. It's a difficult area to do definitive studies, but they are ongoing at the moment and they are developing very well. So I think it's a question of watching this space, but we need proper trials, and we need to make sure that if we want to get involved with stem cells, we do so through proper trials and not in any other way.
Thank you. The next question is to Olga, and it's from Chitra Alaga from India, Rebecca Anderson from the USA, and Judy Slater from the UK. And the question is, what is the role of rehabilitation and exercise in managing progressive MS?
So as Alan mentioned before, rehabilitation is essential in the management of progressive MS, and has to focus on the person with progressive MS. So they're not something that can be advised to everyone, has to be for a specific case. And it's important to improve mobility of the person, make sure that there is exercise to improve exercise tolerance, help to maintain cognitive function, help to maintain, to keep people in employment, or help people to come back to employment if they want to. So there are, it's important to manage the person with MS in general, to improve the quality of life of the person, reduce the impact of symptoms, so also include obviously symptomatic treatment, but exercise, everyone should, and I should, and Alan probably, and everyone here should do exercise. So I always say, this is not something exclusively for progressive MS. It's part of, would be good to have it as a part of a daily routine for everyone. But in particular for people with MS and progressive MS, it is essential to keep mobility, to keep a general well-being, and to improve quality of life.
Thank you, Olga. And we have a question now from Drew Heap and Deborah Tigran in the USA, and Brian Lee in Australia, and also Monica Silva from Canada. And their question to Alan is there any research on myelin repair or neuroprotection? What are the advances in that area?
Well, the straightforward answer to that question is yes. There's a lot of research in both myelin repair and in neuroprotection. When you're dealing with progression, which of course is around loss of axons, loss of tissue, then actually protecting the brain or repairing the brain are two really critical areas to try and develop. But they're complex and they're challenging. So we've talked a bit about stem cells earlier, which of course are one of the approaches towards myelin repair, and there has been some progress in that area. And Olga mentioned that in neuroprotection, which is something we'd want to do not just for progressive MS, but for a whole range of neurodegenerative and neurological conditions, there's also been quite a lot of activity, a lot going on in the UK, some going on in the States, and in other countries globally. And there are studies now in progress which are looking at a number of drugs which we are using for other conditions, but which actually have a neuroprotective component to them, and they're happening now. The MS Smart here in the UK, Sprint MS in the States. So we are focusing on this area. As I say, it is challenging, but through the Progressive MS Alliance, we would be hoping to have far more studies in this area, and in a finite period of time to have treatments.
Great. We have a question now from John Davis, which was sent to us via email. And the question is, how do we know if drugs are having an effect on progressive MS? We don't know how our condition would have progressed without the drug. So how do you measure efficacy? Who's going to take that?
I think,
Okay.
yeah?
Yes, so this is a very good question. We always get this question. So how do I know whether a drug is effective for me or not, since I don't have myself without the medication? But these are if a medication is licensed and is available for prescription, is a medication that's been tested in a clinical trials against a placebo, which it is a tablet without a chemical effect. So I think we assume that this is an effective medication. Whether it is helping that specific person, then it's really down to a discussion with the individual whether he has or she has noticed any change over time, for example. Has she noticed that the course of the disease, where the progression has stabilized or maybe has improved with the medication? So it's really coming from discussion and communication with their own doctor.
So I mean, I'll just add to that it is very difficult as an individual to know whether a medication is having an effect, and that's why clinical trials are so critical. You can't tell from an individual experience, and of course within clinical trials we're not just looking at what's happening to the person with MS, but we're also looking at things like their MRI scans, and there we can see if there's any change in the way in which in the rate of tissue loss, if that's actually being slowed, and that's very useful. But I think that for the individual with progressive MS, you can get a sense over a period of time, and it may be 6 or 12 months or even longer, that gradual, rather subtle change that you've noticed previously has now plateaued and maybe even has improved. So I think it's difficult, but it's not impossible to detect that kind of change.
Okay. We have a question now coming in from Twitter, from David Saffer, who asks, interferons have completely stopped my relapses. Should I continue to take them when I have evolved to progressive MS?
So that's quite it's a good question, and it's a question I think which comes up in clinic a lot. We know that the main effect of interferons is to reduce relapses. And of course, if it's working well, then you're not having relapses. And there's a difficult question as to whether you're no longer having relapses, but you think you may be getting very gradually or very subtly worse, and is that progressive MS? And therefore, should you stop your medication? If you do stop your medication, are you likely to have attacks? So it's not a straightforward question. MS is a very individual condition, and I think it's really important that the individual discusses their clinical case with their own neurologist to decide what's best for them. And sometimes it can be quite difficult. We have this tendency to stop medication when it's being effective, so that's something we should avoid doing.
The next question is also coming from Twitter, and this is, does MS progress faster in men rather than in women?
So
Olga.
That's a good question. So there is some evidence that possibly men with secondary progressive MS develop faster progression than women with secondary progressive MS, and mainly possibly more cognitive impairment than women. But maybe in primary progressive MS, the difference between the two genders is less clear. I think that in general, the difference is a more individual level than effect of gender. But yeah, that's definitely worth further study.
Thank you. And this next question actually has been sent to us by lots of people on email and Twitter, and many of them are just asking about how they can get on clinical trials, how they can get involved in trials.
Well, that's a really good question, and I think there are a number of different ways. I think, first of all, they'll be attending their own hospital and their neurologist, and you would anticipate that the MS team will know about the trials that are going on in their own area and can discuss them with the person with MS and discuss what the inclusion criteria are. Of course, you can go on the web and you can look at websites. MSIF has a very good website which will give a lot of information about trials, and similarly with a lot of the MS societies, they'll actually flag up the trials that are going on. Some trials have their own website, so you could actually see what's happening directly. It can be a little confusing, and I think the first step should always be your local MS team.
Yeah. The next question that's coming from Twitter is from David Saffer, and he asks, is there a way to definitely tell when one has passed from relapsing remitting MS to progressive MS? Olga, would you?
Yes, so there is no way to definitely say, yes, in fact, you now progressive MS. This is something that happens more retrospectively, so during clinical assessment, then we tend to discuss how MS is evolving, And if a person has reports a progression of symptoms in the absence of clear episodes of relapses, so there is an evidence that neurological disability is accumulating despite the fact that there is no acute episodes, then this may have become progressive MS. But what happens is that after a certain period of time, then you come back and say, well, in fact, I would say that this is now 2 years, so 3 years that I've been slowly progressing without acute relapses. Then obviously there is the difficulty, it's not something that can be clearly summarized in 1 day to 1 month. It's something of a longer period of time. But it's also something that comes out with the discussion with the doctor. I'm now progressive. But we don't have a single test to say, yes, in fact, you're now progressive MS.
Okay. Next question has come in via email from Loretta, who talks about the similarities between Alzheimer's and multiple sclerosis. And she wants to know if it's something that there's, the two conditions are worth studying, to looking at these similarities.
Well, I think this is a very important question, because I think we often look at these individual conditions in isolation, and there's a lot to be learned by looking across neurological disorders. I think particularly for progressive MS, where we know there is tissue damage and tissue loss, and there is neurodegeneration, that makes it more similar to several other conditions like Alzheimer's or motor neuron disease. But it's looking at the basic mechanisms that underpin or underlie that neurodegeneration that's important. So that's why it is very useful to look across the literature, to look at the mechanisms that are being discovered, because all of these conditions are very challenging. Nobody really understands all aspects of any neurodegenerative condition. And if we can get some clues from one, which we can then apply to another, that's very useful. So a very good question, particularly for progressive MS.
Thank you. This one's just come in via email, and they're asking, is the Progressive MS Alliance focusing on the immune and autoimmune factors?
Well, I mean, I think the Alliance is focusing on all mechanisms that could result in progression. So the immune system plays a big part, both parts of the immune system. The innate immune system is perhaps less studied and has now become more a focus of research. So yes, the immune system is being studied, and I think particularly the relationship of the immune system then to demyelination and neurodegeneration, and how all of these things link up. What's the relationship? If you impact on one, what effect will that have on the others? So those relationships are really key, and the immune system is absolutely central to that. So a very good question.
There's another question that's come in via email from Anne, who would like to know, she'd like to hear a bit more about nutritional approaches and any particular diets, and how there might be, if there is any benefit on progressive MS.
Yes, so we do not have any evidence that a specific diet helps to slow down or even stop progression in progressive MS. So I get this question all the time in clinic: shall I follow this diet? Shall I go on a specific diet? My personal view is that everyone obviously is free to follow any diet he wants to do. As far as I understand that we do not expect to see a huge improvement from that specific diet. I know that on the online you can see report of people that have actually shown an incredible improvement by following a diet. I think some of the diets are also quite challenging for the person. Either if it's a very strict diet, it's difficult to follow. It's also quite difficult for sometimes for the whole family, because then you'll end up having 4 or 5 different meals, a different type of preparation, and then becoming an obsession, and and then you feel guilty if you don't follow that diet. So in general, it's a bit like exercise. Everyone should follow a very healthy lifestyle, doing exercise, healthy diet, but we cannot really recommend any specific diet for progressive MS. We do not have the evidence to do so.
Thank you. And we have a question from someone in Saudi Arabia, Khulud from Saudi Arabia via Twitter, who would like to know if there's a role of alemtuzumab in treating progressive MS. Is there any evidence of that, Alan?
So that's a very good question. I think the main evidence at the moment is that alemtuzumab has a very strong effect on relapses, and very powerful indeed, and that often results in having no attacks. As a result, patients often find that they are improving both in terms of not having attacks, but also in terms of their mobility, so they see changes. I think a specific effect on progression itself has not been demonstrated, and that's much more difficult. Whether or not, and this is another quite challenging question, whether or not suppressing relapses and inflammation in the earlier part of MS has an impact on the progression that might follow is another very difficult question that's not yet properly answered. So that the relationship, if you like, between that early inflammatory part of MS and then the progressive phase. And you know, when we look at scans of people with MS and look right from the very beginning, what we see is that although they have lesions on their scans when they have relapses, they also have a rather gradual loss of tissue right from the very beginning of their MS. So if you like, there's a very subtle neurodegenerative part from the very beginning, and it may well be that that continues and may not necessarily be affected by suppressing the inflammation. It's difficult to say. And again, it's back to this relationship between inflammation and neurodegeneration. Does one cause the other, or is one a reaction to the other? And that's still a very fundamental question which we have yet to get a clear answer on.
There's another question actually related to that, coming from Twitter, and this is about brain atrophy, and it's about MS and the relationship with brain atrophy in the longer term, and they've also asked if you can explain brain atrophy for a lay audience.
Okay, so it's a good question. So the brain atrophy, you can see as over time reduced volume of the brain. So everyone over time develops some volume loss. Everyone sitting here, we're all losing some neurons.
Some more than others.
Some more than others. But it has been recognized that the people with MS have a faster loss of brain volume over time. But as you know, as part of aging, there is also some development of brain atrophy. What happens is that the cells that are remaining there, so the surviving tissue, adapts to the loss of volume and creates connections to continue functioning in a sufficiently acceptable way. So although there is brain atrophy, there is also some plasticity of the brain for which neurological functions are maintained, cognitive function are maintained. So what happens in progressive MS is that development of brain atrophy becomes more significant, and this is why it is used as an outcome measure in clinical trials. What we want to see is a treatment that slows down or has an effect on reducing the development of volume loss. If it was clear enough, I'm not sure if Alan was.
No, I think that's quite clear. So it's actual loss of tissue over time, and it's more loss of tissue than you would see with normal aging, which is what we're all doing.
Thank you. We've got another question coming on Twitter from Nick, who wants to know how critical is basic physiological research to finding a cure, and how does this translate to the clinic?
That's quite a challenging question.
Yes,
I think that, basic physiological research is really important, because we do know that in MS, the normal physiological processes are affected. There is involvement of what we call the autonomic nervous system, which has an effect on these physiological mechanisms. We also know, and I mean this is back to the exercise literature, that over time people tend to do less, and as a result they do even less. So you become deconditioned. So actually physiological well-being, particularly around cardiovascular, respiratory, is really important. Whether that tells us more about the underlying mechanisms of MS, I'm not so sure. So I think it's very important for the person with MS and very important to manage and understand, but perhaps not fundamental to the actual finding of a treatment for progressive MS.
Yeah. We've got another question from Sally Beck via Twitter. And there's sort of two questions, but she's linked them. What are your thoughts on CCSVI? And any recent trials using statins? And she said they both increase the blood flow.
You do the one first, and I'll do the second.
Olga, do you want to talk about CCSVI?
So CCSVI, I think it's fair to say that we have no evidence of any effect of CCSVI on the brain or on progression in MS. I'm aware of people who had the CCSVI either as part of clinical trials, especially in the States, or as private treatment, and I come from a country where CSVI has been used a lot and still currently used, but it is not something that we can recommend because there is no evidence that is effective. Do you want to take the statins, unless you want to add something?
Well, I think in relation to CCSVI, I think that when the initial positive reports came out in the literature, there was a lot of excitement about it, and there was a huge response from people with MS to look at this exciting area. And as a result, the MS societies funded a lot of research to look at the underlying mechanism of CCSVI, which is really about dilating veins, and also much more detailed studies of the effect on people with MS. And that was a very useful exercise because we now have a very large database, a research base, that really shows little or no effect on underlying mechanisms and little or no treatment effect. But it is based on really sound evidence, and I think that's always how we have to approach any of these potential new treatments, because you can never be sure until you've actually done that really hard research approach. So statins are quite interesting. Yes, you can.
Can I interrupt? So in fact, I wanted to add that I know people who had CSVI treatment and they felt better. So I always get this question in clinic. Well, you say the clinical trials have shown no evidence of this treatment. In fact, I had it and I feel better, or had it I feel the same, or had it I feel worse. So we come back to the question we had earlier on: how do I know that treatment is effective for myself? We are talking about treatments that have been tested in large clinical trials, very sound research. But then obviously an individual person may feel that has an effect. But on a chemical level, on a clinical trials level, that effect hasn't been observed, if that makes things clear.
Yeah. So can I now go on and talk about the statins? So I think statins are really very interesting. I mean, they're obviously an incredibly useful group of drugs which help many people with a whole range of different conditions. They have been looked at in relapsing remitting multiple sclerosis, and there have been several trials, and they've been negative. But there has been recently a trial in progressive MS, which was published in the Lancet, which demonstrated an effect both on the measure of brain atrophy, but also on the patient's own level of mobility or disability. So that's that statin trial, which looked at 80 milligrams of simvastatin, has been positive. It was a relatively small phase 2 trial, so we now really need to go on and do a major phase 3 trial And that's an ideal study to be done internationally, involving many of the MS societies, and also perhaps the Progressive MS Alliance. So I think statins are very interesting. It's interesting that they seem to work in progressive MS, but not in relapsing remitting MS, which gives you some indication of what the mechanism might be.
Thank you. And we have a question from Dorothy in California, who was asked, in order to cure MS, do you have to destroy and rebuild the immune system?
Yeah, quite challenging. I don't think so. I don't think you have to destroy and rebuild the immune system. No. What the approach so far has been trying to modulate it, trying to improve the response in a way that is a correct immune response. But the destroying and rebuild may be a bit extreme. I don't think that's the approach that we are trying to look so far, no.
I mean, we could remember that in MS, we have an altered immune system. Most of it functions very well. In fact, some of it might even overfunction. So actually, it's much more, as Olga said, about trying, when you use the word modulate, trying to influence the immune system so that it functions more normally. So that's not about rebuilding.
Thank you. And there's another question that's come in from Alessandro in Italy. And he's wanted to know more about any planned functional MRI studies in relation to progressive MS, and also in particular in relation to spinal cord studies. Olga,
okay, Alessandro, that's a very good question. Is, you know, the studying the spinal cord with MRI is very challenging for several reasons. It's a very small structure, so it's very difficult to image. But definitely there has been a study with functional MRI, and there will be more studies in the future. The question is to try to overcome the challenges and design a study which can give some important understanding of the mechanism of the disease. But definitely there are functional MRI studies of the spinal cord in MS, and more, I think, are due to come.
I think it's probably also important to make the point that when we say functional MRI, what we're talking about is using imaging to actually, as it says, to see how the brain functions when it's doing tasks. So you have an idea of the working brain. It's not just taking static pictures of the brain, but you're actually looking at what the brain is doing as we are doing things, or thinking, or acting. So it gives you a real insight into how the brain is changing over time, and therefore how the effect multiple sclerosis can have on the brain itself, and is also very useful in looking at things like rehabilitation, to see how you might be able to address some of the problems with brain function and improve it. So it's a very powerful tool. It's quite a complex tool, but it's one with lots of potential for the future.
Thank you. And we've just received a question from Paul via Twitter. And he says that after sexual intercourse, I find my symptoms clear for a short while. Is there a medical reason why?
I can't think of any medical reason why this is happening, and no, I don't think we have an answer for this. No.
Okay. There's Rachel by email has asked, she just wants to know a little bit more about the clinical trials, the process. For example, what does phase 1, phase 2, phase 3 mean?
So that's a really very, very good question, and I think it prompts us just to talk a little bit about how you get from identifying a potential treatment to licensing a drug, and this is a long journey for if it's a new drug, which can take anything up to 10 or 12 years. So if you think that you found something in the laboratory which might actually have an effect in the central nervous system, which will in turn have a useful effect on MS, the first thing you have to do is to do some further studies involving animals to actually see if there's any danger to this agent. The next is then doing a small safety study in small groups of people that don't have any condition, don't have MS, and then you move on to studies that would involve people with MS. Again, small studies which would be looking at side effects and at safety. So that would be what we would call first-in-man trials or phase 1 studies. You'd then go on to do a phase 2 study, which is larger and is actually looking at efficacy. Is this drug useful? But it may not be looking at a clinical measure. It may be using imaging or some protein in the blood or in the spinal fluid to see if there's a really clear beneficial effect from this agent. And if that's true, you will then move on to what we call a phase 3 trial, which is the large definitive study, which would have a clinical outcome and which would be the kind of study which would then move on to the drug being licensed and treated, used as a treatment in the population. So quite a lengthy process. Now, if you have drugs off the shelf that are already being used for another condition, and this has certainly been the case for some of the drugs that we've been looking at in progressive MS, then of course you can move quite quickly to a phase 2 or a phase 3 trial without any of the earlier work, and that's why repurposing of these agents is a shortcut to potential new treatments for multiple sclerosis.
And are there any promising agents around that are being looked at in repurposing trials?
Well, there are. I mean, in fact, the statins, which we mentioned earlier, are a really good example of a repurposing agent. So we know they lower cholesterol, they know they reduce all sorts of risks, vascular risks, but now we have a sense, or at least an indication, that they may be useful in progressive MS, but now would need that phase 3 trial. I think when we go back to neuroprotection, a lot of the drugs which we know to be neuroprotective are drugs which we use in epilepsy, for example. And I could mention a number, but there are a whole range of them. And these are the drugs which we are now looking at in MS. So phenytoin, which is an agent which has been around for many, many years in epilepsy, we're looking at in optic neuritis to get a sense of whether or not it could have an effect there. Lamotrigine, there's a whole range of agents. So repurposing is really very important.
Thank you. We have a question from Cindy in London via email, and she wants to know about if there's any effectiveness of oxygen treatments in MS, in progressive MS in particular.
Yeah, so the oxygen therapy has been studied, and a lot of people are using it. Most people report improvement in the energy level, and I think if you have the possibility of doing it, I know that there are, at least in this country, a lot of MS centers that are offering oxygen therapy. Is something that is worth to explore, but I don't think that the evidence of affecting the mechanisms of progression is there already. This is not something that it is recommended as a first-line treatment for MS, but it is definitely something that, in addition to exercise, healthy lifestyle, healthy diet, vitamin D could be explored.
So I think I'd probably emphasize the fact that there is not a sound evidence base to support what we call hyperbaric oxygen in the treatment of MS. So I'd be slightly less enthusiastic about it. It came out as a treatment when I was starting in MS nearly 30 years ago, and there really is not a sound evidence base for it. So I'd be a little equivocal about using it.
Thank you. We got a question from Martin via Twitter, and he's had some concerns. He's asked, is fingolimod as dangerous as the sources I've read on the internet claim?
So fingolimod, as any other treatment that we use, but not only in neurology, in any other medical specialty, has a list of associated side effects. So this is why every time it's prescribed for a person with MS, that we have to balance the benefit with the side effects. So is a person has to be informed about the possible risk, but also see whether it is useful to try this medication to improve, for example, the relapse rate. So it's true that is associated with side effects, but I think any medication is associated with side effects. You know, even aspirin. I always say to my patients, well, you know, have you ever read the information sheet of aspirin? You know, you wouldn't take that. But everything comes, you know, the other side of the coin with some benefit, and there are some side effects.
And I think that's an important point. It's all the time you're looking at the benefit and the risk. So there's a risk-benefit analysis, and it tends to be the case that as the treatments become more effective, they are stronger, and they often have stronger side effects. And of course, that's why we wouldn't use a very strong drug necessarily with very strong side effects in somebody with very mild MS, but you would certainly think about using it in somebody that has active MS. And this is the balance and the discussion that you would have all the time with the person with MS and make a decision with them.
And in case of aggressive treatment or treatment with the worst safety profile, then you keep engaged with the medical team, with the MS specialist, and come back for regular follow-up and blood tests. So there is a monitoring of side effects. It's not that you give the medication and then you don't see the person anymore. So you also make continue to monitor the effect and the possible side effects of the drug.
Okay, so really we've got through a lot of questions, and thank you both for answering so many of them. But unfortunately we are running out of time now. So I'm just going to ask one final question to Alan, and that is, if I was recently told that I have progressive MS, what would the future look like for me?
Well, I think if you were told that you had progressive MS, the first point is you would look after yourself well. That it doesn't change anything. You look after yourself well. You've got to actively manage your condition as you would, as we've said earlier, with any other form of MS. I think you'd keep really abreast of research activity, because that whole area has exploded and is incredibly exciting, and I think particularly to link in with the activities of the Progressive MS Alliance. You may even consider becoming involved in a clinical trial, which would be another excellent thing to do. And I think you would anticipate a treatment for progressive MS in a finite period of time. So I think positive, very positive, and much more positive now than even 5 years ago. So now I'd like to hand over to Olga, who I think will talk a little bit about how MSIF has supported her in her career.
Yes, so I'm very grateful to the MSIF, because when I finished my training in neurology, I was awarded a Dupré grant, and this from the MSIF, and this was in 2000, so I'm not sure I had to disclose the year, but so that allowed me to come to UK to work with Alan and David Miller at the Institute of Neurology and learn more about MS. And at that time, we did not have treatments available for MS, so a lot has changed really in 14 years. And I think this is an excellent organization that has provided funding for young researchers to move abroad and have experience how things work in other countries, in this case UK, and develop passion for MS if there is one, improve research skills, help people with MS in clinics. So definitely a big thank you to the MSIF, and I think on the website is my smiling face, and I was very pleased. And I think if you enjoy this webinar, then what we really wanted to ask you is to make a donation to the MSIF in order for this kind of activities to be repeated in future, and obviously send your feedback if you want to make some changes. This has to be an interactive process. We also need donation to increase the number of grants that allow young researchers to come to UK in this case, but also other locations for improving understanding and discovering treatments for MS. So I got the figure of about $40,000 we need, or that's about 30,000 euros, to support 5 young researchers to move out of their own country, come to UK, learn more about MS, learn about symptomatic treatment, how to manage these more challenging medications, and then go back to their country to share their knowledge with their teams. So this is why we need your help. Make a donation, whatever you like, even $1 or €1 will be very helpful to allow the MSIF to fund more research into MS, and with the purpose of today, into progressive MS.
Thank you. It just remains for me to thank our wonderful world-renowned experts, Professor Thompson and Professor Ciccarelli, and our wonderful host, Dia, for answering, we hope, so many of your questions. And thank you for sending in your questions and for spending some time with us today. Yes, so really it just says goodbye and see you next time. Thank you.